gehen wir erstmal live. Okay. And where's the button?
Start button.
Ich bin schon live.
I think actually, yeah, we're already live.
Okay, great. Even better. Welcome then to our panel discussion about... sorry.
Start button.
Ich bin schon live.
I think actually, yeah, we're already live.
Okay, great. Even better. Welcome then to our panel discussion about... sorry.
Start button.
That's a recording.
Oh, I'm very sorry. I hear myself double in the background.
Okay, great. Even better. Welcome then to our panel discussion about... sorry.
You probably
Okay.
need to turn off the streaming in the
Yeah,
background.
I found the problem. Okay. Very sorry for everyone in the waiting for us to really start off now, but I think now we can start. So welcome to our panel discussion about Nordic and German views on smart health, how innovation can enhance well-being and an improved quality of life in an aging society, organized by Konrad Adenauer Foundation's regional program Nordic countries. Konrad Adenauer Stiftung is a political foundation named after the first Chancellor of the Federal Republic of Germany. With more than 80 offices abroad and projects in around 120 countries, CAS actively promotes the values of freedom, justice, and solidarity around the globe. The Nordic Countries project of CAS, based in Stockholm in Sweden, strengthens the ties between Germany and the Nordic countries by promoting political dialogue, organizing political conferences, and further improvement of the cooperation with think tanks, NGOs, and the civil society. In this panel discussion, we would like to discuss a topic that concerns us all in the Nordics as well as in Germany, as our societies are aging and our healthcare systems therefore find themselves confronted with a range of new challenges. Adding to that, the outbreak of the COVID-19 pandemic has made health the all-dominant megatrend in all societies that underlined the importance of anticipating future challenges. How can innovation enhance our well-being and an improved quality of life? This is the question that we would like to answer today in this panel discussion with perspectives from the Nordics as well as from Germany. The discussion will be moderated by Sylvia Hartmann. She's the Vice Chair of the German Climate Change and Health Alliance, to whom I would like to hand over the floor right now.
Thank you very much for the introduction, Leonie, and thank you also to the audience for joining us this afternoon or this evening, depending on your time. So hello and welcome from my side as well to our panel discussion on Nordic and German views on smart health. I'm pleased to guide you through the discussion today and explore the question of how innovation can enhance health and well-being of societies. As Leonie already mentioned, the Nordic countries and Germany as well are both facing a demographic shift towards an aging society with new complex health and social care challenges, and at the same time, rising healthcare expenditures. And that's where smart health comes into play. They provide an enormous potential around digital solutions and medical technological research and development. A study from McKinsey from a few years ago claimed that in Germany up to 33 billion euros could be averted by implementing digital solutions that lower both the demand of health services and increase efficiency. Nordic countries are internationally recognized for leading the way in the digital transformation, while Germany, as also the study from McKinsey shows, has fully exploited its potential yet. So therefore, together with the experts from the Nordic countries, we want to explore the question how innovation can enhance well-being and an improved quality of life in an aging society today. To the audience, I also invite you to ask questions either through the Q&A tool here in Zoom or on YouTube, wherever you are right now. Please also pose your questions during the discussion right now, because this way we can easier select the questions we would like to answer in the end of this discussion. Okay, so then let's start directly, and I would like to welcome our first speaker, Göran Larsen. You have many years of experience in science and education, also at the University of Umeå and also at the University of Cambridge, and then you're now Director of Research and Development in the Swedish region of Västerbotten, and you have worked in the region of Jämtland Härjedalen before, another Swedish region. There you are, and you were implementing healthcare solutions. Can you tell us a little bit more about the challenges in these regions?
Thank you, Sylvia, for that question. It's really a burning topic for me. In northern Sweden, in both regions that I worked and working in, and two other regions, we do have, I think, three challenges, quite big ones. The first one is the geography. We are supposed to provide healthcare in a huge area, which is also sparsely populated. So there is always problems how to transfer the healthcare from the hospital to the primary care all the way into the patient's home, so we can transfer the healthcare towards the patients. So that's one challenge. The other one is the demography. I used to say that in Västerbotten and in Jämtland, where I used to work, we are at least 10 years ahead of the demographic curve. There is already a large fraction of elderly people living in our areas, and they are also spread everywhere because we are so sparsely populated. And that drives me to the third challenge, and that's the economy. Basically, we cannot provide healthcare as we did yesterday, because the healthcare we have, the healthcare has improved so much. Now we treat patients with chronic diseases, and that's a lifelong treatment, which usually becomes expensive at the end. And say 10-15 years ago, the treatment time wasn't that long, and the chronic diseases and the multimorbidity is also increasing with increasing age. And since we are ahead of the demographic curve already, that drives the healthcare to become very, very expensive for these patients. And since we also have elderly people, the income, we are basically, our healthcare is tax driven. So we have a public healthcare financed from taxes, and if you have a low income, you also pay low tax, which is another challenge for us to just have enough money or to provide healthcare to everyone. So that's, I think, the main three challenges, and we do work around in innovative ways.
And what kind of digital solutions do you implement currently, or try to implement currently?
Well, we are implementing and trying to implement a number of different IoT or ICT solutions, but we mainly focus on distant independent methods. So we have self measurements and home monitoring of chronic diseases, for example. And I can, in one pilot example that we tried out to monitor patients with heart failure, for example, we could see that in the pilot, it's so easy. If you have a heart failure, you basically have to adjust your medication so you don't gain fluid in your body. And by just putting the patients on a scale connected to Bluetooth, so we can follow the weight change of a patient, we can also provide or stop the heart failure patients to come to the emergency care. So basically, during this pilot testing, we had 0 emergency care patients from that region, because we could adjust the medication before it was too late. So that's one example. We follow blood pressure for hypertonic patients. We do have we monitor diabetes patients, etc. So we focus on home monitoring examples.
And Göran, you mentioned as well when we talked before that these data were sent via Bluetooth, as you mentioned, automatically. And
yes.
That's something that our next speaker, I would say a little bit provocatively, can only dream of. So I'm going to Henning Blumenstein. He's working at the Techniker Krankenkasse, one of the largest German statutory health insurances, and you're there, the digital health expert in the Department of Healthcare Innovation. And the Techniker Krankenkasse also did some surveys on the aging population. What insights did you gain on this, and what are the current trends and challenges in Germany?
Thanks, Sylvia. I have to say that the problems Göran is mentioned before are also here in Germany big topics. We are facing the aging society, and we are seeing rising up of the comorbidities and the chronic diseases rising, with this knowledge, we try to address this problem with innovative solutions. We are trying to develop with partners in our department, innovation and care management, and to implement these in the actual care in Germany. We are using, for example, the same, it's called telemedicine heart for heart insufficiencies, and smart scales also to prevent these events for the deterioration of the condition of the participants of this program. Otherwise, we try to address this problem with preventive measures. So we using coachings to get our insured people aware of their problems, and to try to help them to get rid of the bad lifestyles, obesity, which mostly leads to diabetes, or quit smoking, which is one of the big cardiovascular issues. So we try these preventive strategies to fight these progression of bad health of the elderly in the future from the beginning. But our strategy is at the TK to look at potential and really innovative startups which are on the market to help and fill a gap of care we are now seeing in our portfolio. And with these startups, we try to partner and help them in these difficult market of healthcare, which we truly have in Germany. It's not an easy market, especially when you're a young startup, and the market access is really difficult. So we try to partner and help them through the steps of regulation and helping them from the beginning of their idea to their final product, which is then supported by us in the market. We see also that the digital problems, the digitalization is really hard to keep up with the elderly. The elderly people are often have fear for this new technology, the shift of something they used to know. They used to use like paper or fax or these old ways to communicate, I say. So we try to help them to overcome these lack of knowledge and maybe also the lack of hardware, and help them to get empowered in this process of digital digital inclusion. And we see ourselves as one of the big players in the market for the digital shift in the healthcare landscape, as our duty to help them get along with these challenging digital environment.
Thank you very much, Henning. You mentioned the search for startup. I think these are two nice keywords for the next speaker, Kari Klasner, which is head of Smart Life Finland at Business Finland. And your approach is slightly different. You're actually searching for startups, but your goal to improve healthcare is the same as with all the three other speakers. And the aim of this program, Smart Life Finland, which runs from 2019 to 2022, is to promote personal, real-time and intelligent health and well-being solutions that are accessible anywhere and at any time. So what is your strategy to achieve this goal?
Thank you, Sylvia, for the kind introduction, and really a nice segue from what Henning said about startups and how we also believe that that really is the source of a lot of the most innovative solutions we can see in the market. I work for Business Finland, which is a governmental organization, and our mission is to drive the innovation in many industries, not only health, but here today we'll talk about health. Our mission is to drive innovation by means of using public funding for innovation projects, and also work closely with companies in order to help them international and go global with the digital health solutions in the case of health. So really our goal is to drive the Finnish innovation and the internationalization of Finnish businesses in many sectors, including health. And we have several ways to drive this goal. When you think of solutions, everything has to be grounded on having a relevant offering to solve a particular problem in health and well-being in this case. Now, we have utilizing clever and cool technologies is not enough. We all know that. The proposed solution also needs to provide value to the customer, the healthcare system in the target market in this instance. So therefore, one of our key strategies is to ensure that relevant offering is developed by networking and close collaboration between public and private players, between commercial and public organizations, healthcare providers, and research. So we like to bring all these parties around the same table to make sure that we use the best of all these worlds. So when we do this, we believe, and we have seen, and we have evidence to show that really the sum of what we can achieve this way is much more than the sum of the components. This is where companies will bring in ideas, they will bring in development resource. Health organizations have access to care processes and data and clinical expertise, and research helps structure the problem and come up with scientific evidence to support innovation. So at Business Finland, we call these ecosystems, and we have targeted very specific government funding called co-innovation to fuel the birth and development of these ecosystems. So not only do we fund them, we also help them grow. We help them find the right partners, and we've helped them provide the project plan by which solutions can be brought to market. So that's one thing. Another key component is trade promotion. We're a small country, just like Sweden, with limited markets. In order for our economy, our companies to thrive, we must gain access to international markets and trade. So we work actively to help bring Finnish companies to find the right markets, channel partners, and customers for their offerings. So we organize matchmaking events, we open the doors, we help companies to present their offerings and provide funding for their internationalization projects. And then finally, as a small nation, we have limited access to resources when it comes to capital. Therefore, bringing in international investment to fuel the growth of our businesses is another key component of our work. So this may come in as business angels, corporate ventures, or other forms of capital. So we are working actively to market our country as an international investors to convince them of the value of investment into our small and medium-sized businesses. So I think with all these three combined, that really in a nutshell is what we do in order to achieve this objective.
So Kari, now in case Henning and Göran are searching for startup innovations, like what can they expect to see from Finland during the next years with the help of Business Finland?
Well, in health and well-being, digitalization, as we know, is spreading fast, and new applications and devices are taking over previously manual processes. So they're providing a whole new way for the health system to interact with patients. I think some of our colleagues were alluding to that earlier in the comments. So as an example, digital therapeutics is a hot topic, and many development projects are underway. And what do we mean by that? We mean digital solutions that expand the services of the health system outside the physical boundaries of, let's say, a hospital, in order to assist in the prevention, diagnosis, care, and recovery of patients. So our companies in Finland, we have many such solutions in development in various disciplines, including cancer, respiratory diseases, diabetes, mental health, and preparation and recovering for hospital episodes like surgery. In all these cases, you can use digital solutions in order to help patients with the deal with the disease. Secondly, and I think Göran was alluding to this, age tech. We have a number of companies working in this segment. Societies all over the world are facing a wicked problem of healthcare costs being under chronic pressure and scrutiny, while the demand and cost of care is increasing. A big component to this, our aging population and their growing demand for care and services. And as we age, most of us will need more and different services than today. So therefore, digital health can help address this challenge by automating processes and delivering health services to home, which will ease the burden on the health system and help the aging population live more independent and higher quality life at their homes. And maybe thirdly, so that's kind of two different disciplines that I wanted to mention. Thirdly, AI, more specifically, machine learning. A computer has proven to be an invaluable asset to healthcare professionals in being able to quickly and with very high level of accuracy point out anomalies in the data that it is being given. This capability has huge promise and can apply to various fields of medicine. For example, diagnostics, X-ray, MRI, drug discovery, and patient monitoring. AI can much quicker than any human analyze the data and to compare it to what it's been previously seen to determine if a deviation of a human should take a closer look at its present. This allows for medical professionals to better devote their time to patient care. Also, a computer is very consistent with its determinations. It doesn't have a bad day or a good day and never gets tired as we do as humans. So maybe those three things, I think we have wonderful solutions for, and a lot of these are coming from small startups. Many of them aren't really ready for the international market yet, but we help them do that.
Thank you very much, Kari. AI is, you always mention the keywords that help me go on to the next person. So that's really perfect. So AI is the word for Robert Lauritsen, who's CEO of Cerebrio, a startup that has been founded in 2018 and is actually now nominated as EY Entrepreneur of the Year in the category Startup. And Cerebrio developed a tool which helps to make faster decisions by supporting physicians in diagnosing MR images by using, as you mentioned, artificial intelligence. So how and why will you, Robert, make a difference with Cerebrio, and how will you support well-being in an aging society?
Thanks a lot. Yes, Gary, that's exactly where we are in this space. So winding back a bit from an aging perspective, obviously mental or neurological disorders and diseases are an increasing risk and prevalence, and we are building technology to automate the MRI examination to the extent possible while the patient's in the scanner, to really relieve the use of and the time spent in the examination room for those where we can rule out pathology, and then if we detect pathology, to ensure we get the right data for differential diagnosis by the medical professionals, the radiologists. Now, this in the diagnostic space is growing quite fast. There's a 9% increase per year in diagnostics, and obviously nearly 1 billion people with neurological disorders and diseases is driving part of that growth. And the aging population is the underlying fundamental challenge. So what we're looking at is a future that is becoming gradually more bleak, with increasing burnout in radiologists, the specialized medical doctors reading these images. And basically, they're looking for a needle in a haystack. And this is a perfect place to use machine learning technology to detect these abnormalities early on, and to reduce the amount of healthy images and sort of you can say bluntly, waste of medical expertise in looking at all these healthy images when looking for this needle in the haystack. And this is where technology like what we're building for hospitals can come into play, because we can allow for very short examinations and thereby increase the throughput to detect and rule out pathology. If there is a pathology, especially if it's acute, we can highlight that and notify that to prioritize that patient and the care of that patient more promptly. And thereby also, which we've learned the past 1.5 years, enable the prioritization and triage of patients that actually need acute admissions in neurological beds, but also to therefore release and reduce the length of stay for such patients when they don't need an acute neurological bed. So looking at AI and what we're doing is just an example of using this kind of technology where we can use the abundance of data that's out there. Getting access, of course, is always a challenge, but the abundance of data exists for building this kind of solution. And we can go from now the brain and eventually to all other body parts, where we imagine with the increasing accessibility and affordability of low and medium field MRI, that this kind of diagnostic equipment will become readily available in communities. Also in the very far north of Sweden or Norway, we're working with also Norwegian hospitals, as to be able to screen for early signs, early biomarkers of mental disorders, to be able to prevent or reduce or slow down the disease effect and the symptoms in early and preventive treatment. And this is also inspired by countries like Japan that have been doing this now for a couple of decades with a screening program, basically diagnosing the entire working population with brain MRI every year, which is not possible in our part of the world. There's just simply not enough equipment. There's simply not enough radiologists. We believe in a future, maybe in a decade or so, where this will become readily available in hospitals and in clinics around the country, and where we can regularly screen the aging population for early signs of not just neurodegenerative diseases, but also critical pathologies like tumors or hemorrhages and potentially stroke or other cardiovascular diseases.
And Robert, just to sorry to interrupt you, but
sure.
Aging society is one of the trends in our societies. But Leonie said, I'm also co-founder vice chair of an NGO that copes with climate change. So environmental change is another one. And you mentioned in our pre-talk that Costa Rica could also help to maintain our livelihood. Maybe you can just mention that shortly. Like how can digital health solutions also have a kind of co-benefit in other topics of our society?
Well, I think what we're also looking at is use of chemicals, typically used in diagnostics, where we can reduce the need for chemicals and reduce the use of chemicals, which leads to chemical waste, which is also traceable in the people that are subjected to this for literally years following that. It can provide the comorbidities that are derived from these kind of chemicals, like organ failure, etc. And of course, especially for the younger population, this is something that by all means everyone is trying to avoid. But the strange thing is, when we're looking at it, we want to support the higher quality of life of an aging population, but we still CT them quite often, which is exposing them for ionizing radiation. We're putting chemicals like gadolinium-based contrast agents into them to ensure that we flare up pathology or biomarkers so we can diagnose them. But in many cases, that's not necessary. There's a huge difference between the traditional diagnostic approach, for instance, in some German clinics we're talking to, where it's quite often more than 60% of the neurological imaging that they're doing, they're using this kind of contrast-based gadolinium. In Denmark, it's more around 20%, but we can believe it can bring it even further down, not just important in pediatrics, but actually also for the aging population, but ultimately also for the environment. So we can trace, and there are studies tracing these kinds of chemicals in the drinking water in cities near large hospitals.
So you're also kind of preventing over-treatment, we could say, and by this you're also maintaining life. Yeah,
exactly. We call it personalized radiology, right? So if we can avoid chemicals, if we can avoid 30 or 60-minute scans, we can do with just 5 minutes. How can we do that without having the doctor in the room? We can do that by having very fast machine learning-based technology to rule out the pathology, to avoid the recall, to avoid that whole sort of slow moving system. And this is where this kind of technology can make a difference.
Thank you very much, Robert. Henning, when you're listening now to the other three on the panel, how prepared is Germany for implementing both digital solutions but also other like non-digital smart health solutions?
Yes, we try to keep up with these fast-paced digital transformation we see in other countries, like in the Nordics, and we try to find the perfect fit for us here in Germany, the balance between data security on the one hand and the benefit for the for the insured people and the population on the other hand. And it is really important to prepare our society for this. As I mentioned before, we see ourselves in the duty to empower the population for these digital shift, but also want to thrive for the further implementation of these digital aspects. In terms of AI, Robert, you mentioned it before, we are seeing a good balance, hybrid approach by using this technology to help the physicians and radiologists to have more time with their patient and have more time to do the consultation using this technology and have a better diagnosis and better strategy for therapy approaches. And we really looking for these kind of startups which are helping us in this market. Yes.
Göran, you were also looking for startups, and you led a project called Wellbeing in the former role in the region of Westerbaden. So Wellbeing was a consortium that invited startups to develop, test, and evaluate their solutions in private and public hospitals, in health centers and care services or settings. what did you learn from this projects, and what kind of also maybe smart health and also like digital and non-digital smart health solutions did you find there?
I think Welltel was the start of a kind of a change management in my region, where we looked into the collaboration with small SMEs and even large companies. I believe that the digitalization is so fast now that the public healthcare, we don't have the tools to cope up with the fast change. So we need to collaborate with the experts, and the experts are the companies, because they are experts on their specific things. But Welltel learned one thing I learned from Welltel, and that was that you need innovative environments. When we had our meetings, the agenda usually kind of guided us where the discussion during the meetings, but the creative discussions was not during the meetings. That was around the coffee machine or in the evening during dinner, etc. So we actually learned from that and opened a co-working area in Östersund, my previous county council town, and that co-working area basically it's the e-health center, and in that e-health center, the co-working area, we have the private companies under the same roof, we have the county council, the healthcare under the same roof, and we have the municipality working with digital solutions under the same roof. And you had a creative environment that actually boosted the Welltel project even further. So I think that's one thing that I learned, and that we need to collaborate and co-design solutions, because we need to pick up the needs from the healthcare, but also have physicians and nurses being part of the innovative design of the solution, because otherwise it will not be used. You need the buttons to be on the right places, etc. You need to have automatic transfer of data, otherwise there is a source of error, or someone has to type in the data, etc. So I think that's something that I learned. Regarding AI, I think Finland is have a good example, because you have a data lake and then with anonymous data of healthcare data. In Sweden, we don't have that, and the legislation is really lacking behind the fast development of digitalization, because we lock our data into silos in 21 county councils and 290 municipalities, and that is really a hurdle to get across. So I think there, Finland, I believe in Denmark you have something similar, I guess. But I think that's and I think we should actually collaborate in the Nordics, because even our small countries is not enough when we are looking on really rare diseases and try to find patterns in diagnosis or treatments for rare diseases. There we should work within the whole Nordic, and why not Germany as well. And there is it's called Nordic Interoperability Project, I think, NIP, which has a focus on how to collaborate across the borders even.
Thank you very much.
Did I answer your question?
Yeah, thank you very much. Maybe, Robert, now so far 14 hospitals have validated Cerebrio. Maybe you could just talk a little, shortly about the challenges for you to scale up your health innovations, and also what do you need in terms of political and financial support to even further scale up your innovation?
Yeah, so, did I unmute? Yeah, I did. Yeah, so we are collaborating with hospitals really across the globe and doing validation. Obviously, COVID has reduced the direct access, because I completely agree with what Jørgen says. We have to be there see the medical professionals work with the technology, make sure to bring back that learning. We've been co-creating in our approach since we were incepted in 18, basically working with clinicians and technologists and radiologists, etc. But by far, the regulatory pathway is set. The amount of clinical studies we probably have to do, because we come into also what the EU Commission just recently wrote in their AI approach, is the explainable, transparent technology. And here we need to have good demographic variance, equipment variance, etc. So part of the validation is actually a fairly long path where we validate on German data, Nordic data, US data, Japanese data, Israeli data, etc. We're really in UK, etc. So we're outside of Europe and working across the globe. First, performing a number of studies, which take time. But we also believe that we already now have something that we can move into pilot. So we are looking at arranging the first sort of real clinical use, not just testing, here in Denmark and in Norway, and we'll be reaching out and are in dialogue with hospitals also in Germany, in France, etc. Besides outside of EU, because we only have a CE mark at the moment, and we'll be looking at other regulatory approvals in other countries. It is medical device and need to be regulatorily approved. So of course that is incredibly expensive, and we're not profitable. We won't be profitable for a number of years before we are just deployed well enough out there. So institutions like where Henning is coming from, etc., are the institutions we are interested in having meetings with to ensure that we can get that kind of support to make that reality happen and really allow us to bring the future that we believe is what we need to help an aging population.
Kari, the Nordic countries, they're also undergoing another trend, and it's the paradigm shift to a more patient-centric view and reform. How did this start off in Finland or in the Nordic countries? And also when you say like you want to foster innovation and you want to bring Finnish startups to other countries, will you support its spreading of this patient-centric view? And if so, how? Maybe also because Göran said he would also like to see a little bit more of collaboration between the Nordic countries and Germany. Do you have any ideas for this as well?
Yeah, thank you. To me, the patient-centric view is all about data. It's all about transparency. It's all about all different parties being able to see the same data set when it comes to a particular patient. It doesn't matter if you're a private doctor, if you work for a public organization, if you're a workplace health doctor, or if you're the patient, you should be able to see the same thing. And that's actually what we have implemented in Finland. We're a leading country in digitalization of health, and we put together a electronic health record system covering the country. It's called Kanta. The National Health Archive is the name of the system. If you Google it, KANTA.fi, I think, you'll find some English description of it. So it's one consolidated, unified system comprising of health and prescription data. And also in the future, we're adding social welfare data to it. And really the core of the system goes back in decades. I think they started somewhere back in the 60s. This is where we maintain medical records, prescription for all of our population and all medical professionals. It doesn't matter what they do, they have access to this data. And what makes this system really clever is that I, as a citizen, also have access to my data. So I can view that, which is a huge tool in empowering myself to better understand my health and the different interventions. What has been done with me? What did my doctor say about my condition when I visited them? I can see that. I can see the transcription. I can see prescriptions. So there's 100% transparency in us being able to view our medical records. And also now what we added to it recently is the capability of adding personalized welfare devices like heart rate monitors, smart watches to the system, so that they will automatically interface with the system. So if I have an Apple Watch or a similar device, I can hook it up to my electronic health record. So I can see what's going on with my heart rate, and my doctor can see that too. So this is an invaluable tool also for the medical professionals to better understand my health. And more devices are, by the way, being added to the system as they get validated and approved by authorities. So when we with this, and then with the addition of social services data, we truly created the 360 view into the health system. And then one more thing about this, Göran mentioned research and how they don't have a unified data lake. Well, we actually have that, as I described. And we've opened that data lake for research. So if you want to conduct medical research, you can contact the appropriate authorities in Finland. It's called FinData. On their website, you can submit your research application. Here's what I would like to do with my data. And then you can enter negotiations with FinData, whether or not you get access to the data. This is open for all Finnish companies and research and healthcare providers, as far as I know. And also international partners, like from Sweden, can participate as long as they work with the Finnish counterpart. And you'd have to follow the rules, and patient confidentiality and anonymity would have to be ensured. But I think to wrap it up, I think it all boils down to transparency, collecting the data and making the data available for different purposes.
Skepticism regarding data security is one thing we talk a lot about actually in Germany. So maybe the Nordic countries, they're well known for their healthcare registers. Maybe, Göran, you could talk a little bit, because in Sweden you have this health register. It's mandatory since already 1984. So you have several decades of experience. But do you still have the skepticism sometimes also regarding data security? And if so, how do you deal with this if it occurs in your society?
It's a tough question, and I think it depends on who you ask as well. There is a way to get hold of data. You need to have the patient's consent, and then you can get the healthcare data for research purposes. There is also an ethical approval procedure that you have to go through before you can access the data. And the healthcare doesn't give out any data without an ethical approval. But it's true that you say that we have had EHRs for quite a long time now. And in Sweden, we actually now are in a system shift, where I think there is a lot of county councils now changing from one EHR system to another. And we are currently in the middle of that.
So as we only have like a few minutes remaining, I would like to go into the kind of final round of where do we want to go? So what's our vision? Henning, I would like to start with you. What do you envision regarding smart health for Germany, or smart health for the Techniker Krankenkasse? So where do you see German in the future years?
Thank you, Sylvia. I have to admit that I'm a little bit envy about the great progress in Finland due to data lake and the usage of data for research purpose. We in Germany, and especially we from the Techniker Krankenkasse, we are trying to utilize data in the future with the consent of the insured, and with the sovereignty of the data is lying by the insured and the person who owns the data. But we want to make these data more. We want to try to have predictive models to predict hospitalization risks, for example, or medical interference, which causes a lot of problems with the with the medicine of older people. And these all leads to more specific recommendations of the diverse ecosystem we here in Germany have with the offerings, with the digital offerings, so that we can see the patient on a healthcare journey, and we know where he is on this path, and can recommend the right preventive or curative offering to help him in his specific situation. We see the personalization of this process of healthcare in particular, and want to help our insured people to with our good digital offerings and analog offerings, of course. Yes.
Thank you very much, Henning. Robert, what is your vision for the future of Cerebrio? And also another question, from your experience as a startup in Europe, I would say now, for more countries, do you have any ideas how innovations could be simplified in Europe?
For sure, in this space, I think I mean, also working with some German hospitals, I think there's quite a long way before all of Europe has maybe reached the level where Finland is, with a very sort of well-structured and accessible set of data, which is the fundamental resource required outside of money and good talent, of course, into actually bringing solutions to life. The data is the fundamental resource that is required to build anything in the next generation health tech world. So we just one example of innovation in diagnostics for healthcare, and we're starting within the neurospace, but obviously we'll need an abundance of data across body parts and modalities, etc., to expand what we're doing in one place to realize that value in other places. And the only way we can get there is well-structured and accessible data that, of course, adheres to GDPR. And I think the GDPR is one of the challenges that I at least have sensed have blocked and stopped some progress and slowed down at least the progress with innovation. But the recent initiatives from the EU Commission, I think, will be driving the agenda back on track and inspired, I think, to many extents in what is going on in Finland, which I think is a shining example that most countries in Europe could benefit from being inspired from.
Thank you very much, Robert. Kari, the program that you're managing of Business Finland has two areas also: living environments that promote health and well-being and transforming healthcare. What are Business Finland's visions for these two areas? Okay, that's a great question. There are maybe three things that we see, and I think this might be easily agreed with by colleagues. So let's see. First off, our vision is that as we move on to the post-COVID world, the interest and the importance of one's health will continue to increase. I think that's a big trend which will not go away. So people will become more and more conscious of their health and will want to have the visibility, access, decision-making authority over issues that impact their well-being and health. So health was important before, now it's becoming even more important. Secondly, the environment that we live in plays a major role in our well-being in many ways. How we live, in what type of conditions do we work, how we move about from place to another, and what do we do in our spare time. All these impact health. So by clever design of the environment around us, we can promote health and well-being of citizens. The obvious areas of application include indoor and outdoor air quality, prediction and prevention of infections, and passive monitoring of symptoms and behavior to predict and prevent the onset of a disorder and disease. So really the big holy grail of healthcare is the shift from curing disease to predicting, delaying, or completely preventing its onset. So this is where digitalization comes with a huge promise in providing a complete view into the patient's health, allowing for medical professionals to focus on proactive prevention rather than the reactive care, in a way that's never been possible in the history of mankind. Yeah, thank you also for mentioning creating the right environment that nudges healthy and good lifestyles. Göran, so I will hand over the words to you as well as final speaker. What is your vision for the region that you're working in currently for the future?
I have a vision and basically a keyword for that vision, and that is together. I believe that we have to transfer the healthcare by collaborating. And I have a vision that that half of Sweden, basically northern Sweden, that's half of Sweden. It's like 8 Denmark areas or something. Can be a mega test site for innovations within healthcare and social care. And I truly believe that is possible to do. We have one university hospital and a number of regional hospitals, and the primary care that is well developed and mainly also public driven, basically. And that we could, by doing that kind of a mega test site, collaborating together, we could also have interest for fundings from EU, for example. So I think that the New Horizon project program could actually finance all 4 sectors. And a quadruple helix, that means that we need to have the healthcare, the academia, and the companies, but also the citizens or the patients should be involved in the development of the future healthcare. So that's my vision.
Thank you very much, Karen, and thank you very much to our panelists for this great discussion. Of course, this was only a small and tiny insight into what smart health means, what smart health can be. We could not cover all the topics that you're working on in this hour, but still, thank you very much. And for the audience, you have now the possibility to stay in this room. Leonie will explain it to you in a second and discuss this topic further in between each other. Thank you very much.
Thank you very much. Thanks for having me.
Thank you.
Great.
Bye-bye.
Thank you.
Thank you.
Thank you also from
Have a nice evening. Bye.
from us.
Have a nice evening, you too.
Foundation.
Nice meeting you.
Thank you very much for being here. Thanks to all the speakers. And yes, for the attendees, if you would like to, then you can stay in this room. I will also stop the recording now, so none of what you're going to say will be recorded. Because as a part of the Conference of Europe, we invite you to share also your opinions on